It is recording.
Hi, Katie.
Hello, Jody. Let's see if I can share my screen.
Okay,
Here we go.
wonderful. Well, I am just so glad to be here today with you, Katie. I'm Jody with Wellspring Solutions, and we are partnering with AuthoraCare Collective, specifically Katie Wangelin, who is the Director of Social Work, to bring you a very important topic, hospice versus palliative care. And before I turn it over to Katie, I just want to share some information with you about the services that we offer from Wellspring Solutions. We do offer memory screenings. They are free and confidential. We are licensed to offer the Memory Fitness Program. We are certified to offer the Dementia Dialogue Series. And we offer home and community-based services to caregivers and their loved ones, mainly with dementia, with our Memory Care Center, Connections, a Memory Club, which are group respite locations. We offer caregiver support and education. We have home care in Guilford County. And if you're not sure what services would best meet your needs, we have our navigator, Nicole. She can visit with you in person or over the phone at no charge to just discuss with you what resources, whether they're with Wellspring Solutions or not, again, might best meet your needs. You can always call us or visit us on our webpage. And we also have our Thrive program. So please check that out. It is an opportunity with CARES Act grant funds for you to get self-care activities virtually and access to supplies that go along with those classes. So now I'd like to go and turn it over to Katie, and she is going to again be talking about hospice versus palliative care. So Katie, again, thank you so much for being with us today, and I'll turn it over to you.
Well, thank you, Jody. I'm so honored to be invited to be here today with you in this virtual world. And I am going to start by just talking a bit about hospice care. We're going to start by defining hospice because I think that is potentially it's just a confusing term. When people hear hospice, they often think hospice comes in the final moments of life, or hospice is a place. But in fact, hospice is expert in-home care for people who are not seeking further curative treatment for advanced illness. So hospice patients are those who are really focused on achieving comfort for mind, body, and spirit. So again, folks who are aware that they have a significant advanced illness for which curative treatment may no longer be an option, or the pros and cons of seeking ongoing treatment suggest that in order to live life to the fullest and spend time with family and have pain well managed, curative treatment may no longer be the path they want to be on. They may prefer to elect hospice, which is, again, medical care for people who are no longer seeking curative treatment. Hospice is offered by a team of people, but the most important feature of this circle of care is the patient. So the person who is receiving hospice care, the person who has a significant, serious advanced illness, and then surrounding that person are their family and friends. And we know that family can look different in every single home. Family can be a community of people surrounding a patient. It can be blood relatives. It could be what we call fictive kin. Family is whoever the patient says is their family. And we bring the family and friends into the care. We make sure that the patient feels supported and that the family and caregivers are center at decisions that we make about care. The other experts who are involved in that care in hospice are the hospice physician, registered nurse, the hospice aide, volunteers who are trained and participate in a variety of ways in patient care if the patient and family are interested in that. We have a team of bereavement counselors. We have chaplains who provide spiritual support. social workers who provide clinical support for emotional and psychosocial needs. And then also included in that circle of care is the attending physician, who is typically the physician who has referred the patient and family to our program. So often we are asked at AuthoraCare, where can I receive hospice services? So we might hear from a caregiver who says, well, my mom lives in a skilled nursing facility and she already has nursing care provided. To which we say, okay, well, we can come into the skilled nursing facility. And in fact, we partner with many facilities in our community. And we also go into independent and assisted living communities. We provide hospice care in inpatient hospice units. And certainly we provide care in wherever the patient calls home. Our services through the hospice program, there are many services. I'm just going to touch on a few of the ones that I think we hear caregivers and families say are most supportive for the entire family. So the first I'm going to mention is that the nurse and the hospice physician work collaboratively with the family and with the patient to provide pain and symptom management as well as education, because we know that sometimes pain is made worse when we don't understand what's happening. So the patient may feel uncomfortable, but not really understand why. And the nurse and the hospice physician can come alongside the patient and family and explain the why. Hospice also provides medication related to the life-limiting illness, medical equipment and supplies that are related to that illness as well. The hospice program has 24/7 on-call nursing support. And for AuthoraCare Hospice, that means that at any time of the day or night, a patient or caregiver or family member can contact our clinical call center and speak with a nurse who's going to help troubleshoot what's going on. In some cases, they can say, well, I can see from here, I'm able to pull up your list of medications, and I think that it would be good to try this medication now. Or maybe it's a good idea to go ahead and go to the hospital and be admitted for symptom management. But nurses can also come to the home any time of the day or night if there is a symptom or a concern that the patient and family would really feel better if a person came in and assessed on site. I mentioned social workers as a part of that circle of care. And as a social worker, I can see many, many ways that social workers come into the mix when supporting families and patients. We provide what we call biopsychosocial support. And what that means is we look at the entire system. We look at the family, the community surrounding the patient. We look at the patient history. We learn about the family and the patient. And we use that to help us understand, are there unmet emotional support needs? Or is there a trauma history that might be playing into pain management? Or are there unresolved family dynamics that are causing the patient and the family to have unnecessary additional stress? The social worker comes in and assists with those needs for patients and families. We also offer spiritual support through our chaplain program. This is a voluntary service, but one that we really encourage all families to consider accepting. Our chaplains are not focused on necessarily a faith-based approach to spiritual support, and honor what each patient and family bring to the table. So our chaplains are highly trained and aware of myriad faith traditions and really focus on spiritual care and spiritual support. So that means talking about those big questions like, what's going to happen when I die? Am I at peace? What can I do to feel more ready for this? Certainly, our chaplains also provide comfort and support to families and caregivers as well. We have volunteer program where trained volunteers can assist with a number of things, including running to the store to pick up groceries for a caregiver who is exhausted, for driving a patient to an appointment, or we have wonderful volunteers who write cards to our patients who are veterans to thank them for their service. So our volunteer program is another layer of support, and we cater what we're able to offer through our volunteer program to whatever needs we see come up for the patients and families that we're working with. Another benefit from the hospice program is what we call short-term respite care. So this is an opportunity for a caregiver family to take a break from physical caregiving, the day-to-day caregiving. So let's say a patient lives at home with his wife, and his wife has to have knee surgery. And during the time that she's having surgery, she's very concerned about her husband's care, and there's no family that can locally be there. Well, the hospice program can offer short-term respite stays for the patient to go and stay, typically in one of our inpatient hospice units, Beacon Place or hospice home, where the caregiver can rest assured that their loved one is being taken care of and is kept comfortable while they take care of their own needs so they can get stronger and provide ongoing care. We also help families and patients discuss advanced care directives. So these are things like the healthcare power of attorney or living will. We help patients consider what their wishes are for end of life care. And we really can help explore the interplay between, again, as I mentioned, spiritual care. So chaplains can get involved in that conversation to help explore the interplay between maybe spiritual beliefs or spiritual concerns. The social worker can come in and talk a bit about what does one's cultural background or family system think about the patient's choices at end of life. And we all come around the patient and family in that circle of care to help the patient make decisions that meet their own goals for end of life. We are also really happy to be able to provide additional services, and I think that makes AuthoraCare a very special program because we have a very robust counseling program for children and adults across the lifespan. We provide care around anticipatory grief, and we're going to talk more about that in a little bit, but also bereavement care. So grief support for those who have lost a loved one. And one of the things that makes me most proud of working for AuthoraCare is that those services are not just connected to hospice patients. So what I mean is our counseling support is available to anyone in the community who can benefit from that kind of support and care. And community support allows us to offer that at no charge to the counseling recipients. Hospice recipients also have access, if they're interested, to hospice aid and homemaker services. So a certified nursing assistant who comes to the home and provides assistance with personal care. And then we also have, I think I mentioned Beacon Place and the hospice home. Those are what we call inpatient hospice units. And they are located, the Beacon Place is located on our Greensboro campus. Hospice home is located in our Burlington campus. And in those facilities, we provide short-term inpatient care for patients who are experiencing pain and symptom management issues. So sometimes in the course of an illness, somebody might need a little bit of extra care. They might need to be monitored more closely to get medications just right, or the doctor and nursing team may need to assess what's really going on, what's the source of this pain. So we have the opportunity to bring patients in to our inpatient units to do that observation and provide pain management. Because again, our goal is comfort for mind, body, and spirit. So who is eligible for hospice care? I want to clear up a misconception that I hear a lot out in the community, and certainly I've even heard it within my own family, that hospice care is only for people in the final days of life. The reality is that hospice care is available to anyone whose physician has assessed that based on the predicted course of one serious illness, they have a prognosis of 6 months or less of life. Now, of course, we can never predict when somebody's life will end. And there are certainly patients who live well beyond that 6 month prognosis, but hospice stays involved and continues to evaluate. As long as that patient has an illness that's progressing, hospice care can continue. And what we found, and there's research that backs this up, is that patients and families benefit most from hospice care when it's provided for the final weeks and ideally months of life. And one of the reasons is that that gives the patient and the family a chance to get to know each other, build trust and rapport, and for the caregivers from the hospice side of things to really have a sense of what's this patient's story and what can we do to best support their goals at end of life. I like to mention too that hospice is at the center, it's patient driven. So a patient always has the right to decide to stop hospice care and resume curative treatment. Another big question is who pays for hospice care? Well, Medicare plans, Medicaid, and most insurance plans provide hospice care and cover that care. The way to access the hospice care is that a physician has to predict that a patient has 6 months or less of life, and the patient has to have decided to no longer seek curative treatment. They can seek comfort care. They can seek what we call palliative treatment, which is, we'll talk more about this in a moment, but that's treatment that is to help manage symptoms. But curative treatment is not a part of the hospice care program. And I think I said this before, but I think it bears mentioning again, that 6 month prognosis is just a guideline. We reevaluate our patients every 60 days. And as if we're monitoring a continued decline, then patients get recertified for ongoing hospice coverage. And we have patients who what we call graduate from hospice. And what that actually means is that they've become a hospice patient, they've had that circle of care come around them, and in some cases, their condition stabilizes. Sometimes just the stress being alleviated, pain being more well managed, family dynamics being a little bit more in check with some support from the social work and spiritual support team. And sometimes when all those things come into play, a patient might stabilize and no longer meet criteria for hospice. Now, they can always come back to the hospice program when they again meet criteria. But we do have folks who we call it graduate. What we mean is just that they no longer meet criteria because their condition has stabilized. And then how do you get in touch to access hospice care? So I represent AuthoraCare Hospice, which is located in, we have a Greensboro campus and a Burlington campus. We were formerly Hospice and Palliative Care Greensboro and Hospice of Alamance Burlington, and our two agencies merged and have now formed AuthoraCare Collective. And for many reasons, this is great, including that both of our organizations prior to merger had very long-standing and positive reputations in our communities. We are experts in hospice care and have been doing it for decades and decades. And in addition to that, we are bigger and have a larger collection of resources. So I'm going to talk a bit more later as well about what that collective means. What are some of the other services and programs available through AuthoraCare Collective? All that being said, there are hospice programs all over. So if you're watching this and you don't live in a county that AuthoraCare Collective serves, that doesn't mean you cannot access hospice care. There are hospice programs nearly serving every community in North Carolina and in our country. So you can reach out to your attending physician and ask about making a hospice referral. In our community, in Greensboro and Burlington community, we have the AuthoraCare Hospice program, and you can just call our main number, which I'll provide at the end of this conversation. And you can just talk with one of our referral specialists about whether or not hospice care would be beneficial for you or your family at this time. The referral specialist can then contact your attending doctor and discuss what's happening with your medical care right now and would hospice be appropriate. And we like to encourage people to contact us whenever they have questions about end of life care. I mentioned that collective that AuthoraCare Collective has. So not only do we have hospice care, but we have palliative care. And our programs are growing and changing all the time. And so we are looking at other ways to come alongside people who are dealing with serious illness and provide support. So by simply calling us, we can assess your situation and consult with you and give you a sense of which of our programs might be the best fit for your needs at this time. So we talked about hospice care. AuthoraCare also provides palliative care, which I mentioned earlier is care that is the goal of palliative care may be to continue ongoing curative treatment. So in other words, people who are under palliative care can access this resource at any time during the course of their serious illness, from the time of diagnosis throughout curative treatment. They can continue to have palliative care. Palliative care, an example would be somebody who has a new cancer diagnosis and they have a prognosis that maybe is 5 years of life. Well, that they don't qualify for hospice care based on their prognosis, but they could use some support and some pain management and comfort care. And so the palliative care team can get involved to consult and provide education and recommendations to the attending doctor and the medical team about how to keep that patient comfortable through the course of their illness. So I like this graphic. I think it's a great way to understand when each of these phases or levels of care come into play. So for healthy adults, preventative care is the standard. We hopefully are going to see our physician on a regular basis. We are getting our eyes checked, going to the dentist, all of those things to help us stay as well as we can possibly stay physically. And then somebody may begin or be diagnosed with a serious illness. For many people, depending on their age and stage of life, and certainly a lot of other personal factors, they may seek curative care. And the medical team may be encouraging them to seek curative care. And at that point, palliative care can come on board. Palliative care can begin from the time of diagnosis of a serious illness. Now, as you see, once we get down closer to where it says terminal illness, hospice care can become involved. What I like about this graphic is that it shows that there are patients and families, however, who remain on palliative care for the entire course of illness, and that is totally fine. So palliative care patients are never pushed towards hospice care. They are given that option once they meet criteria for hospice care. And the palliative care team may recommend hospice care because with hospice care comes a little bit more the service intensity. The resources become a little bit more frequent with hospice care. But again, somebody can opt to stay under the palliative care program for the entire course of their illness. It's a difference between palliative and hospice care is that palliative care is less comprehensive. It's more consultative. So we have nurse practitioners who go into home, facility, wherever a patient lives, to meet with them and talk about their serious illness and the symptoms they're experiencing. Then the nurse practitioner recommends medications and therapies that might help better manage those symptoms. And then the palliative care team also helps the patient and family understand their illness, talk about advanced care directives, healthcare power of attorney, living will, and they help patients make decisions about their future health care. The palliative care team has that nurse practitioner that I mentioned. There is also there are also social workers on the palliative care team, and we, in some cases, have the option of bringing in spiritual support through the chaplaincy program. So, palliative care, that circle of care is a little smaller than that comes with hospice care, but it's still a great smattering of supportive care for a patient and their family. Just like hospice care, you can receive palliative care in your home, but you can also receive it in long-term care communities. And AuthoraCare partners with skilled nursing facilities, memory care, assisted living, independent living, and group homes to provide care in those long-term care communities. If a patient's living in a long-term care community, we work very closely with the community, the nursing staff at that community, the other disciplines at the community, to make sure that we're coordinating care and providing the best collaborative care that we can. And much like hospice care, palliative care is paid for through Medicare, Medicaid, and most private insurances. Sometimes people want to know if they can continue receiving physical therapy or home health services while receiving palliative care, and the answer is yes. So, what if you've heard all about hospice, you've heard about palliative care, and you don't think that either of those are quite the right fit for your needs right now? So, I'm speaking to you, especially you caregivers who do the tireless work of providing physical and emotional care for your loved one. AuthoraCare Collective also provides support and education for caregivers. And caregivers do not need to be associated with the palliative program or the hospice program to participate in many of our supportive services. So this is just an overview of some of the caregiver support that we're able to provide. At the top of the page, you'll see this is a link to a specific part of our website that's dedicated to caregiver support. And at this link, you will find more information about consultation for advanced directives. So one of the things we can do is just consult with caregivers and patients, even those who aren't affiliated with our hospice and palliative programs, to talk about advanced directives. We also provide caregiver education at the Lusk Center, which is a beautiful newer facility on Summit Avenue in Greensboro. You may have driven past it. And in the Lusk Center, we hold caregiver education series that are typically offered at no charge to the community. Right now, because of the pandemic, many of these offerings are online. So we have a series of webinars called The Power of Knowing, and we've made webinars that have already occurred. We've made them available, and you can access them at the website here, the link that says The Power of Knowing. That's a part of the AuthoraCare website, and you can access those webinars on a number of topics. You can also see the schedule for upcoming webinars. So I checked just to see what's coming up, and I think one of my favorite webinars that's coming soon is it's all about, oh, I wish I could remember the name. It's something like what can you do beyond the casserole? So the idea is when you are a friend or a community member and you're trying to support a friend or a loved one going through serious illness or dealing with the loss of a loved one, we all know, especially in our Southern culture, that we sometimes feel compelled to bring a casserole. But this particular webinar is all about what else can you do? What can you say? What kinds of support might you offer beyond offering a casserole? So that's a great training, and it's coming up in June. If you're interested in that, you can look at our website and you can register right there on the website. We also provide community counseling. We have individual counseling. We offer workshops and support groups. And those, again, are offered to the community at no charge. Now, these are grant funded and community supported programs, and they are all provided by licensed clinicians. So not only are they available at no cost, they're really quality because they're provided by licensed clinicians. And here at the bottom, I say services are expanding. And that is because AuthoraCare is seeing immense growth right now. Our service area is expanding into counties that we haven't been in previously. Our census, the number of families and patients that we support through counseling, palliative care, hospice care, consultation, is increasing. And with that expansion, we are really looking at other ways we can support patients and caregivers who are dealing with serious illness. So keep on checking back and check our website as we grow and expand on our services. I wanted to bring this conversation to an end by just sharing my own story. It's a real life example, and it's the way I like to help others understand how a family might access and benefit from this array of services available at AuthoraCare. So in 2019, around the holidays, my mother-in-law started to have some symptoms that suggested something was going on neurologically. And so she went and had a scan and was diagnosed with a pretty serious cancer diagnosis. Now, I live in Greensboro, and my in-laws live here as well, but we have family all over the country. Many of us have young children. And so certainly one of the first things we thought about is, what are we going to tell the children, and how do we manage this diagnosis and the reality that she's had a very serious change in her medical condition, while also continuing to live life as a family. And so, because I work for hospice, I was aware of palliative care, and we brought in the palliative care team to work with my mother-in-law and my father-in-law and provide education about her diagnosis and prognosis, and about options to manage her pain and discomfort. Now, luckily, her pain was pretty well managed through the course of her illness. But there's a lot of comfort for the family knowing that we could call the palliative care team and ask questions about changes that we were seeing. We knew that the palliative care team could be contacted if it was 3 a.m. and my mother-in-law had a significant change in her condition. We knew that we could call somebody and get a live person on the phone. And sure enough, about a year after her diagnosis, she had a significant change in her condition, and we knew that she needed to have some symptoms managed and observed and monitored more closely. And so we called the on-call team and determined that she needed to go to the hospital for some symptom management. And so that decision was made, and she went to the hospital. This was right around Christmas time in 2020. So she went to the hospital, and they did some scans when she got there. And very quickly it became clear that she was beginning to enter the transitional time towards end of life. And my mother-in-law and family agreed that she was ready to stop seeking curative treatment, and she was ready to move into a hospice level of care. Well, on Christmas Eve, she was transferred from the hospital to Beacon Place in Greensboro, which at the time was immensely helpful because we were not allowed to visit her in the hospital because of the pandemic. So at Beacon Place, family could visit. She was more comfortable. Her Her symptoms were very well managed. She was able to see many of her family members. And then she passed away very peacefully at Beacon Place on Christmas Day. She had family by her side. She had been able to spend time FaceTiming with her grandchildren. And I cannot imagine, as hard as it is to lose a significant loved one in your life, I cannot imagine a more peaceful and perfect end to her story. That's the end of her story, but our story, as we know, continues. The grief that the family experiences when a loved one dies is significant. And so I am pleased to say that family members are receiving ongoing grief counseling through AuthoraCare, as well as the children. The children have access to workshops and supportive programming to help them process their feelings about their grandmother's death. And it's just really powerful to see the way that AuthoraCare has honored the story of my family and provided that ongoing wraparound care, even when my mother-in-law's story ended at the time of her death. And I hope that's a good way to illustrate the way that palliative care, hospice care, inpatient care for symptom management, and then grief support following the death of my mother-in-law were all services that we accessed through AuthoraCare Hospice. So with that said, I wanted to share my contact information in case anyone has questions, wants to talk more about your specific situation, and see if I can help direct you to the right person in the agency to get you the information you need. Or perhaps you have a loved one who lives in a different service area and you'd like a recommendation about how to connect with hospices or palliative care programs in that area. Feel free to call me or email me. And I really appreciate your time. And Jody, I should have invited you back to say, do you have any questions or anything I didn't touch on that you'd like to hear more about?
Katie, I thought this was a very thorough and understandable presentation on the difference between both and when it's appropriate, who's eligible, payment. I actually don't have questions. But again, viewers, if you do have questions, please contact myself or, of course, Katie, if they're real specific to hospice and palliative care. And if you have questions about caregiver support, I so appreciate you, Katie, not only sharing your time and your expertise, but your personal story about how hospice benefited not only your mother-in-law, but you as a family, and then after with your grieving. So yeah. So thanks so much to Katie and to AuthoraCare. And I know some of you who are watching have been to the beautiful Luck Center. We've been very fortunate to have the Luck Center host caregiver support offerings, including our retreat that we just haven't been able to offer with the pandemic, but we look so forward to be able to meet in person and have some of those self-care opportunities and opportunities for valuable education and just empowering yourself with information. So I look forward to getting back to the Luck Center and seeing you in person, Katie.
You too, Jody. We were ready for you to come back.
And thank you for joining us. And just please stay in touch if you have questions.
Thank you. No, we stopped it.